do you know if you have binge eating disorder? What about some of the signs that you have? Is it full disorder or is it just binging? Well, in this video, I'm going to be talking about exactly that. What exactly are the signs of the full binge eating disorder? So hi, I'm Vanessa McLennan, a clinical hypnotherapist, psychotherapist, and I help people with their binge eating and disordered eating so that you can have a life free from food stress. So if you would like to know what are the exact symptoms of binge eating disorder, keep watching. Binge eating disorder, like any disorder, can gradually get worse over time. But how do you know if you have the full, disorder? Because sometimes you might binge out and it might be every now and again, or sometimes you might have, a spate of lots of binges, or you might not think they're severe. So it can be really confusing because it may never be the same pattern all of the time, or it may be, and you're like, well, is it a full disorder? What is it? But it's like any disorder, there will be some sort of pattern to the amount that you're doing it, so the frequency, and also over the amount of time that this behaviour has been happening. Many therapists and mental health professionals will refer to what is known as the DSM-5, which is a diagnostical and statistical manual of mental health disorders, and 5 just relates to the latest version. So in there it sets out a specific criteria that you have to meet to have the full, binge eating disorder. So it's never black and white, because you might meet some of the criteria and not all of it. And if that's the case, then you will have binge eating symptoms, but perhaps not the full-blown binge eating disorder. I think what's really important though here with this video is not to diagnose yourself. This video will give you, the criteria and some pointers, but if you think that you do have full-blown, binge eating disorder, I think it's important to go and talk to your doctor. So there are 5 criteria that you need to have binge eating disorder. So criteria 1, an episode of binge eating is characterised as having both of these following. First one is eating a large amount of food in a short period of time. So that time could be over a 24-hour period, and you are eating an abnormally large amount of food for that time period. Second is that you have a sense of a lack of control around your eating that large amount of food. So you could have a large amount of food, let's say at a dinner time, or you're having a celebration, and you would normally eat, a larger amount of food. But with binge eating disorder, there is a sense of that you have no control over it. So it's a bit different to, overeating. When you overeat, you have a sense that you are full and that then you can stop. But with binge eating disorder, there isn't that. You may notice that you're full, but you just can't stop. There is no control over how much you keep eating. Criteria 2, binge eating disorder is associated with 3 or more of the following: eating much more rapidly than normal, eating until you feel uncomfortably full, eating large amounts of food when you're not feeling hungry, eating alone because maybe you feel embarrassed or you don't want anyone else to see what you're eating, and then feeling, embarrassed or disgusted, revolted with yourself over what you've eaten or the amount that you've eaten. So having 1 or 2 of those may be, a pattern of yours, or maybe normal sometime, like for instance, we're out somewhere and we have to eat quickly. So you see, one of those on its own, in some every now and again, it's not going to be the full binge eating disorder. So that's why the criteria is saying you have to have, at least 3 of those, and also on a regular basis. And so that's the key, is to keep a note of your patterns on how often that you are having these episodes. Now, if you find yourself that you are secret eating, sometimes watch my video up here to find out more information about it. Criteria 3, marked distress regarding binge eating is present. This is not just a case of, oh, I've just eaten too much, whatever. We all might feel sometimes we've overeaten something, or we've eaten something that perhaps we wish we wouldn't have, and we might feel a little, oh, damn it. But healthy eaters can let that go, because we know that tomorrow, tomorrow is another day. Where with binge eating disorder, there is that huge amounts of anxiety or disgust, or in feeling embarrassed or guilt, about that what you've just eaten, and these feelings will be present then for quite some time. Criteria 4: binge eating occurs on average at least 2 days a week over a 6-month period, or at least 1 day a week over a 3-month period. I think this frequency is what really separates from the binge eating, just episodes, to a binge eating disorder. Now, if you perhaps do binge, but you're not as, once or twice a week over that length of time, it's still something to look into and to get help with, because, as I say, that could get worse steadily over time, and what's causing your binge eating is not going to go away unless you look into it and work on it. Criteria 5: so binge eating is not associated with any other compensatory type of behaviours. So these might be purging, or frequent exercising or excessive exercising. And binge eating does not occur exclusively with bulimia or anorexia. I think this is what separates binge eating disorder from other disorders, is that binge eating stands alone without any other forms of behaviour. So there is a severity grading to get an idea of whereabouts you are. So mild is having 1 to 3 episodes a week. Moderate is 4 to 7 binge episodes a week. Severe is 8 to 13 episodes a week. And excessive is 14 plus episodes a week or more. So the severity grading is just a guideline, so just so you can get an idea of whereabouts you are. If you are not sure whether your eating is an issue, you will know for you if it's a problem. If it's a problem and it's distracting you from everything else in your life, you're not able to enjoy your life because this is taking over your life, then you will go and seek help in your own time. A good way to find out how sort of big an eating issue is for you is by noting down when you have binge eating episodes, and then you can see the frequency and how often it is, and this way then when you are ready to go and talk to somebody about it, you have some form of log for yourself, because otherwise it just gets jumbled all in the head, and it can just all stay up there, and then it's very unclear as to what your patterns are. But just note, whenever you are ready to talk to somebody, just note, do it in your own time. And if you are experiencing these episodes, go easy on yourself, because it's happened for a reason. It's happened for something perhaps in your background, and it can be very, very difficult to confront yourself, and let alone then bring it to somebody else. That can be very, very challenging, but just know that there are plenty of people out there to support you and look after you when you feel the time is right to go to somebody who can help you. Thank you.